land whose beautiful landscape and topography is one to behold.
Her people not just warm but too hospitable alone.
A nation sewn together by the resilience of her people. A country where the common aspirations of a healthy nation drives their determination to do everything unique.
I run marathons.
This is the story of a campaign that has stimulated social dialogue and promoted political and social accountability for the health of mothers and children. In this program, we traverse the highlands of Kisii to the plains of West Pokot and Turkana, all the way to the savannah of Makueni County. We will sail the length and breadth of the lakeside to bring you the narrative of what has transformed the lives of many in a bid to have a healthy nation. Beyond Zero, a model of personal sacrifice for the good of the nation, whose outcome has touched many lives across Kenya. And now, 47 fully kitted mobile clinics are inspiring and changing lives in the countryside. Welcome to Beyond Zero. This is how it all began way back in 2014. First Lady Margaret Kenyatta stepping out of the plush life of State House to champion the cause. After weeks and months of mobilization, advocacy and partnerships, these mobile trucks have become the beacon of hope, transforming lives across Kenya. And 33 months down the line, the last of the 47 mobile clinics was delivered. This novel idea has given opportunity for partnerships, collaborations, and new innovations across the country. Every county has its unique concept of harnessing the mobile clinics beyond the original mission of offering maternal and reproductive healthcare solutions.
Nilikuwa sijaona na macho yangu, ndio nimeona.
This sojourn begins in Bungoma County, found near the Kenya-Uganda border, with a history all the way back to the construction of the Kenya-Uganda Railway in the 1920s. The people of Bungoma are a busy lot, engaging in agriculture as their main economic activity. But a cultural practice hinders them from achieving their reproductive health well-being in the 21st century.
Yaani msichana akioleka na kijana wanakuwa na mapenzi sana hata mpaka kijana akanyonya matiti. Sasa hiyo huwa ni lazima mama ajifungulie nyumbani ili waoshe haya matiti na madawa ndio mtoto aanze kunyonya.
Kama msichana ametoka kwao ameoleka na sangine is not a virgin. Sasa akiona hivyo bwana yake sangine anaokopa.
A tradition that demonstrates how negative stereotypes and outdated beliefs pose a great challenge across the 9 sub-counties.
Watoto wa mbele wanne nilijifungulia nyumbani. Alafu wa mwisho ndiye nilijifungulia hospitali.
But all this has now changed as a result of the advocacy and easier access to maternal health services through the collaborative efforts of Beyond Zero.
Like we are using a lot of the community health workers or volunteers. These are the people who are bring the mothers to deliver, encourage them to go to the nearest health facility.
Beyond Zero has provoked several out-of-the-box initiatives, all complementing each other, the greater aim being to improve the overall health of the community.
So through the network of the CHUs, we have got records of all mothers in all the communities indicating the stages of their gestation or pregnancy, so that where Beyond Zero is not reaching, this community health volunteer is able to get to the household of this mother and just sensitize the mother on being very careful on her very critical dates.
Dr. Lusaka herself has come up with her own program motivated by Beyond Zero to bridge the nutritional gaps in the county, working hand in hand with others like Ambulance Mashinani and Maternal and Newborn Initiative.
And through my foundation, Skip a Lunch Initiative Foundation, I encourage every woman who gives birth in a health facility, the baby gets new clothes and the mother gets a lesson, so that they are encouraged to come and deliver in hospitals.
It has also elicited a great sense of excitement, with many now growing the desire to emulate it. As a result, locals who have been seeking health services at county facilities are now benefiting from the complementarity of the partnerships.
Afia Plus has gone out of their way to even recruit supplementary staff for us as a county government.
Traditional birth attendants have not been left out either. They too share in the excitement, as do volunteer community workers who are now on board as they play their part in the new phenomenon.
Sasa wakati ule vile tulijifunza tukawaachia hao, sisi hatusalishi nyumbani. Anakuja tu kama ako tayari, ninamshika, naona mtoto ako karibu. Namuitia tu, tuko na mtu anaitwa potapota ambulance. Nikimpikia tu simu, tatikatana ameingia hapa. Na ninamuweka, nampelekea daktari.
Na yeye mwenyewe hata atachua tu uko na mimba kiasi gani. Hata ukimwambia vibaya yeye atachua tu. Bora atumie hiyo mikono yake.
Anaweza kushughulikia ujifungue vizuri. Lakini wakati huu hata ndiye anaweza chukuliwa hatua kwa nini amekubali ujifungulie kwake. Inatakana uwe umeenda labda hospitali.
Sasa mimi akifika kwangu kama ako karibu kabisa na ninamsaidia. Na nikiona dalili yake mbaya na ninaamka na nampeleka hospitali.
Unlike before, postnatal care, preventive and curative services including HIV are now being sought voluntarily through collaborative programs with Afia Plus, while the Kangaroo Mothers program is a unique innovation that seeks to ensure the health of babies delivered before their full term. The valleys and ridges of Kisii have not missed out on this phenomenon. This mobile facility has also been snaking its way through the beautiful green scenery. This county tells a story of a people that have suffered stigma related to HIV/AIDS for many years.
Kukubali status ndio kitu ya kwanza. Unakubali hii ni wewe na tena kukuwa na virusi sio mwisho wa maisha.
Asnath Mugambi learnt of her HIV status after participating in the First Ladies Half Marathon in 2014.
Namshukuru the First Lady. Sababu kama siye, maybe singekuwa najua status zangu. Hiyo the zero campaign yenye alifanya huko na hiyo stadium. Mseka patikana kwa negative niko positive.
But Beyond Zero has rekindled the hope of they that had been isolated for being victims of the scourge. While for 32-year-old Husna Atieno, the launch of Beyond Zero in Kisii County opened a new chapter in her life after she got tested in the clinic.
unaweza kuwa na virusi na tena unaweza saidia watu wengi kwa kufuata ili waende wajijue hali, na tena wanaweza saidia community. Badala ya kukufa unaacha watoto kama wako wachanga, unaweza endelea na maisha kama wengine.
Kennedy Guaro, a boda rider in the county headquarters, would be living in misery if not for the services provided by the mobile clinics.
Tulikuwa tunafishana na vijana mchezo tu. Wewe uko sawa, wewe mimi, wewe uko, wewe ndio umeisha. Tulikuwa tunatania mtu amekonda au mtu amenona ndiye ako na virusi.
He got tested there following a comrade's banter at their terminus.
Nikaenda kwa Beyond Zero wakati wa kulunch. Nilipimwa, sikuamini macho yangu.
For Kennedy, Husna and Aznath, Beyond Zero has helped them come to terms with their HIV status.
Nilipima nikajijua hali, kumbe nikajua ati unaweza zaa mtoto hata kama uko na virusi, unaweza zaa mtoto mwenye ana virusi. Sasa hiyo kitu ilinitia moyo.
Huko kijijini pia ninawaelezea wenzangu, ninawaambia about my status. Ingawa kuna wengine unajua si wote wana accept, wanaamini, wanakuambia vile uko health, unatudanganya. Lakini nawaambia ukweli ili wajue nao unawaleta.
Vile serikali imefanya mzuri, ukipatikana na virusi unaanza dawa sahihi. Unaona? Kama sisi tungejua siku ile nilijua na nianza dawa, singegonjeka. Lakini siku ile ulikuwa unapeleka process CD4 count, majibu inatoka Kisumu ama Kericho, uletewa mpaka hapa ndio kuja kuanzishwa wewe hivi uko stage gani, mtu amekufa.
For the majority of other residents, this is one initiative that has not only made access to Medicare easier, but also bridged the economic deterrents to accessing the services.
Sasa hawana uoga sana ya kuingia kwa hospitali kuchekiwa, eti niende kuchekiwa nitakufa. Hii ugonjwa ya ukimwi ya ayui wamejua sasa ni kitu unaweza kaa nayo, unakaa rafiki na yeye.
Beyond Zero has also helped boost the delivery of maternal and other curative health services to places that would otherwise be very difficult to reach. Through collaboration with the county government of Kisii, efforts to boost prevention of mother-to-child transmission or PMTCT have been stepped up.
Watoto walikuwa wanakufa kabla wafike miaka 5 wamekufa juu wakina mama walikuwa sana wa virusi. Lakini tangu hii Zero kampeni ilianza, watoto wetu watu wanalindwa kutoka kwa tumbo mpaka kwa sariwe.
And the results are impressive, including greater male involvement.
Hii virusi, there are smaller chances inaweza fanya mtoto apate virusi ukimwandu, lakini ukifuata masharti kabisa hivi, in the years coming we cannot have watoto wenye wako na virusi unless tupuse.
From the highlands where stigma has found its solution to another on the lakeside where stigma has left HIV numbers alarmingly high.
You know, HIV is still a disaster. And when something is a disaster, there are a lot of people coming to support you.
Homa Bay County, the rugged terrain of 8 sub-counties, and here the narrative is of a unique location. This unique automobile has become a great attraction for more reasons than one, from the county administration to other health stakeholders to the ordinary mwananchi.
We have made it a bit consistent with this vehicle to come here almost every month unless otherwise.
They all love the fact that this mobile clinic offers integrated services.
You get HIV and AIDS counseling and testing. You get the VMMC, that is voluntary medical male circumcision. Children under 5 are immunized, deworming, screening for cancers, counseling. So this is a one-stop shop.
Here, the clinic traverses the vast county, penetrating through sometimes impassable roads in a rotational outreach mission 4 days in a week.
Despite the bad roads, we try to reach those people who cannot reach the facility. Yes, those people who cannot take their children for immunization so that they complete their schedule, we reach them there, we find them, and then we give them the service.
Through this service, strategic partnerships have been struck between the county government and other stakeholders with a view to harnessing the full potential of the project.
The partners are riding on Beyond Zero to go to the hard-to-reach areas to conduct these services. And this shows the political will even from the county government, because they are ready to support us. And as partners, we are happy to utilize the services.
Through this, the outcomes have been many. Skilled deliveries have not only improved, but also neonatal statistics gone up since 2014.
Ikinyesha hatuwezi fika Magunga. Ni shida. Sasa tukiona tu Beyond Zero, hii gari kubwa hii, tunaona nzuri, tena tunafuraha.
Mimi napiga tu asante kwa ajili ya kwa hawa watu wa Zero. Kwa ajili wakikuja hapa najua tutapata madawa nyingi ya ugonjwa. Sasa naona waendelea tu kukuja.
Wakifika kule hospitali, hospitali imejaa hivi. Hapo kuna matibabu. Lakini mkikuja paka hapa, mmefanya kitu mzuri. Tena tunashukuru kabisa. Tena tunasema msidi kukuja.
Ka ber nitie nikech ka okori ni dhi nyiewo yath ka yath nika.
And with regards to HIV/AIDS, there has been a massive reduction in bedridden cases due to behavioral change.
Kwa sababu tukienda kliniki mara nyingi tunaenda na yeye, akienda tunajua our status, HIV status, tunapata tuko sawa. Pia mtoto pia anafanyiwa huduma kamili. Sasa tunaona hakuna good health.
The county government has also tapped into Beyond Zero to implement its HIV strategic plan, which involves provision of support services for enhanced HIV/AIDS management.
We already have partners coordination forum, and we meet every 3 months so that we review what each and every partner is doing. And whatever the work plan of every partner is actually with us.
From the county of 26% HIV/AIDS prevalence rate but scaling down to one of high but diminishing mortality rate among children under the age of 5 years. This is Siaya County, where expectant women would prefer personalized attention and male midwives.
With male, they have a lot of courtesy and they have a lot of feelings for the mothers and the pain they are undergoing. So they tend to do a lot of tender loving care, TLC, for those mothers. So that's the reason why mothers always have preference.
We have a living example.
The tale of integrated services delivery replicates here, but in Siaya, Beyond Zero has helped in the campaign against teenage pregnancy, which is a major problem in the county. During the outreaches, teenagers are sensitized on the dangers of teenage sex and the need to seek professional health care for those who are already expectant.
Tumepata maagizo, tumefunza vilivyo tunaweza kuishia sisi wa tusijiingie kwa peer pressure. Na tumekuja kutibu watoto pia.
When a child gets pregnant, she's too young even to be a mother, a good mother even for that matter.
Further, the county government is running a bursary program to ensure girls are not dropping out of school due to poverty, a major cause for early marriage.
For me here, I decided that fine, why don't I nip it at the bud? And that was, going around to schools and looking also for mentors, to talk to our young girls and even their parents, to see that how do we bring up, and guardians, how do we bring up our girls and our boys.
Through the County First Lady's Office, Siaya has a motivation program for expectant mothers.
We have the Mother Baby Pack. We are gifting mothers who have given birth in hostels, and it's a way of creating awareness, to communities that if you give birth, then there are gifts that you can also get. But even if you don't give gifts, you are also saving your own life and the life of your baby.
So this is supporting mothers who go to deliver in a facility. We have seen a number of mothers now coming up to deliver in specific facilities.
The county administration has a community health volunteer program that comprises more than 100 health units in the 6 sub-counties to coordinate health provision services.
CHWs. CHWs, si naitwa Nyamrerwa, Kijaluo naitwa Nyamrerwa.
Tunaona raha kama Beyond Zero inakuja, watu wanakuja wengi, na siku hiyo sisi tunakuja hapa kama CHVs kufanya RDTs, hata kufanya test yoyote, alafu tunampa tu wanapewa dawa.
Everywhere the mobile clinic goes in its 13 outreaches per month, the people love the quality of services they receive at the facility.
Na vile imesoea sasa nakuja every month. Sasa hawa naulizaga mimi kila siku, wapi hiyo hospitali yako naitaka Beyond Zero?
Mpango hii mzuri.
Kwa nini?
Kwa maana mimi napata dawa bure bila pesa. Wewe najua pesa ndio zinapewa sisi na kufa.
Mama kapsul sigimu anya chiel achiel. Ya chiel didek, ariyo didek.
Kachange kaber.
Akipana ndiye mzuri.
But are there any other efforts born out of the Beyond Zero model?
It is supplying oxygen to various health facilities. Currently, since it started about 2 years ago, there are about over 50 health facilities which are actually getting oxygen from this plant.
These trucks helping to sensitize Kenyans on the importance of seeking Medicare services further manifests itself here, the home of about 900,000 people. Makueni County, a semi-arid expansive county in lower eastern Kenya.
The mobile clinic came. We were actually able to spice up these outreaches, and currently we incorporate the Beyond Zero clinic to our outreaches, and this has created more demand.
The increased demand for healthcare services has led the county government to set aside at least 6 million shillings per year to facilitate the outreach program enhanced by the clinic.
There is a kitty that is set aside specifically for the Beyond Zero, and that means we have some money to cater for staff allowances. We also get a lot of drugs from all the sub-counties anytime we go for outreaches.
And in just 1 year, more than 24,000 people in the county have been served at the Beyond Zero clinic. Cancer screenings alone shooting up by 400% from 1,000 to 4,000 over the period.
Even cervical cancer, prostate cancer, even esophagus. And that one we have seen the number are going higher. Why? Because people have gotten the knowledge.
Yes. In a year we test maybe about 1,000, maybe 2,000 cervical cancer screening. But now we've seen the numbers grow almost 4 times courtesy to the Beyond Zero.
Nimepata usaidizi hata nilipotoka hapo niliwachapia wenzangu wote wako hapa nje wanakuja.
Skilled deliveries and maternal services demand have also increased from 19% in 2013 to the current 50%. Dr. Andrew Mulwa, the County Executive Committee member for Health, talks of how Beyond Zero has opened new horizons for the county. They are set to trailblaze the construction of a referral maternal hospital with a bed capacity of 130 patients.
So that any mother or any gynecological or maternal and child health issues can be handled in a specialized hospital that will be handling maternal and child health issues within the county. Of course, with theatre, with ICU, with even pediatric neonatal ICU, which I think only Kenyatta has such facilities.
Makueni has also pioneered a tailor-made medical insurance scheme targeting at least 92% of its population that is not covered by the National Hospital Insurance Fund.
We sought to start a scheme that is way cheaper than NHIF, because we're charging 500 shillings per household per annum to enter into the scheme. You get a card for you and your household, and you seek health within the public health facilities of Makueni without paying any other fee within the county.
Beyond Zero is actually opening our ways, because the moment they start getting these comprehensive services in the bush, we are referring them to the nearby facility. So our community will have changed their health-seeking behaviors to the healthy facilities, not only to the mobile clinic. It will have already shown them going to the hospital is good, because they will have seen the results.
Such is the impact of Beyond Zero to the Laikipia County community, which experiences heavy rainfall like many other highlands in Kenya. But there is no stopping this van from reaching out, shine or fall. The mission continues. And the people here love the opportunity, which is why they defy all odds to do what they would otherwise never do. Coming here, regardless of age, to, among other things, get cancer screening and HIV/AIDS testing.
Tulikuwa tunasikia kwa maredio hiyo ugonjwa ya kansa imekuwa mingi sana. Sasa tukaamua tu hata kama hakuna mahali unasikia, tukasema tukawanelea tuwasha twende tupime.
Juu nimekubali kupima hiyo ugonjwa ingine. Sasa sina namna, ningepima tu. Lakini nikiamuka hapa niende town hospitali, siwezi enda kupimwa ukimwi, hapana. Hatutakangi hiyo.
If they are sick, they know early enough and they can get treatment from there. So Beyond Zero, we are so much related with them because of the transport, and they are fully equipped. That's why we chose them Beyond Zero.
Naona maridadi sana. Mzuri, pema kila mtu pia dawa yake. Kila mtu pema kilo nini na pia dawa.
As the Beyond Zero mobile clinic reaches out to the far-flung areas, the county has intensified its monitoring and evaluation by purchasing supervision vehicles for fixed health facilities.
And these vehicles are purely for supervision, primary health care only.
The county has also increased its bed capacity in the facilities and constructed maternity wings with theatre facilities and pediatric wards in all dispensaries and other health centers.
Because of the idea behind the Beyond Zero, the county government allocated money, and we have managed to decongest Nanyuki teaching and referral through construction of a pediatric ward.
In Samburu County, childbirth is now a professional exercise embraced by traditional birth attendants. This is also the first devolved government to buy its own mobile clinics to supplement the one delivered by the First Lady.
Now we have two more Beyond Zeros, one in East and one in North, serving the same. And the county health management team have also gone ahead by giving the 3 of Beyond Zero a MFL number, that is a facility by itself.
The 3 mobile facilities have handled more than 5,000 cases in 165 outreaches through some of the most difficult terrains, covering distances as long as 400 kilometers across the vast county.
At times, there were places that we are not able to get access to go and offer the services because of the nature of the county. So Beyond Zero has done marvelous, and that's the way to go.
And the old men here see the benefits of the mobile clinics in twofold: a hospital that follows them to their homesteads and a savior during times of conflict.
Sababu hakuna mtu wiko na pesa kwenda huko, wana mara na kurudi. Sasa hiyo sina furahi wakati naleta hapa ndani kuzunguka ndani.
Kike toko ndenga na taza.
Lakini amefanya kitu kubwa sana.
Kiko mtongana pa utomoya tenenga titini pokora nayo.
Kuna watu wengine wakati siku ya pili mara mbili zilikuja watu wengi walikuwa wagonjwa.
Kesho ndio waipa hata.
Walipatia madawa yote ilikuwa nayo.
Ni shule lolo tongana.
Na wagonjwa walikuwa walipona.
Talking of vastness of Samburu and reaching out to people who would otherwise be hard to, we drift over to a county covering 77,000 kilometers square. Turkana County, the cradle of mankind.
Yeah, and we are neighboring countries which are not even doing vaccinations in their areas. So the Beyond Zero is supporting us. It will reach the places where we don't have the facility nearby. We reach those people who cannot be reached.
Here in Lodwar, the incredible stride is a drastic drop of HIV prevalence rate to 4%.
It was 7.6% prevalence, but now it has dropped to 4%. And that one is attributed with the money that we are putting in the HIV activity. This 2016 we gave them 10 million.
Nimeenda nyumba kwa nyumba kuunganisha mwanaume ambaye yeye ni positive na bibi ni positive, kuunganisha wote waende kuelekea kukunya dawa. Na sasa hivi karibu watu wengi wanakunya dawa na wanaishi vizuri na wanaishi na virusi na maisha yao inasonga.
Turkana County, which has seen remarkable improvement on key health indicators, has a unique innovation inspired by Beyond Zero.
We have improvised with the squatting stools. When the mother sits on a stool and the nurse is there to receive the baby. And this stool, you know, it assists the mother to push because he will not use a lot of strength.
The sound and tracks of these life-saving trucks fill the air and the ground in different parts of the country. From the hills to the valleys, through the thicket and forest, it is clear that nobody has been left out across the breadth and width of the country. It is evident that Beyond Zero has lifted a heavy load off the shoulders of many Kenyans, to the delight of them and health professionals, including those in the vast West Pokot County.
Clinic ambaye siku ya ambaye clinic atakuja tulikuwa na shida sana. Clinic sasa imekuja kwa mwezi 4. Sisi tumepata watoto wetu wamepata bari vizuri sana na amekaa na mama amesikia vizuri sana. Hata sisi wase tumepata madawa na tumebona sana.
Itakuwa mzuri ikujange tu kwa kila mwezi ndio itakuwa afadhali. Kwa maana hata ukikuja sasa leo na kuna wanawake wanasasalia nyumbani bila usaidizi yoyote, unasapata mwanamke amezaa na ameaka. Sasa ni mzuri vile umekuja hapa ukue unasaidia mpaka mwisho. Kila mwezi ukue unasaidia. Yes.
Beyond Zero inapokelewa vizuri sana kwa sababu hakuna dawa yote ambayo inafika pande hii na hakuna hospitali yenye iko pande huu. So watu wanafurahi sana kwa sababu wanasapata chanjo ambayo watoto yao wengine tunasapata watoto mwenye wako zaidi ya mwaka mmoja hajapata chanjo hata moja. So anapewa chanjo zote, kumaanisha ni ya muhimu kwao kwa sababu hawajakuwa nayo. So watoto wanapata chanjo, wamama wanapata, wamama pia wale wajawazito, wale wagonjwa wanapata.
The First Lady's vision and determination to follow through its realization has midwifed partnerships and collaborations towards achieving this milestone, one that has transcended its original objective.
We still need to deliver many more clinics to the counties, like especially in the northern part of Kenya. They need many more mobile clinics with the nomadic communities.
The delivery of the mobile clinics has only been a significant first step. The second is even more promising.
My dream for Beyond Zero is a women and children's hospital. Well, actually, probably more than one.
Nashukuru Bi Kenyatta aendelee tu na hii kampeni tangu ailete hii nchi yetu ya Kenya, imesaidia wote, vifo sio nyingi, vifo vimeenda chini.
I think is unique in Africa. It's an initiative that represents the role of women. She has the women at heart.
It is a high time when the national government and the county government steps in to ensure that there is sustainability of such kind of programs.
Watu wengine siku hizi aende hospitali na ngoja tu paka Beyond Zero kuja.
The premise of the achievements so far predicates a narrative that can only get better, because now we know that we can do more by working together to have a healthy nation.
Margaret ya president, mwambia Margaret ya Pokot yuko, na akasema hebu kuja hapa mimi naongea na wewe.